Dr. Sauter, thank you for joining us again on Health Connection. Always a pleasure to have you.
Thank you.
Title of the segment is Cancer Risk, You May Be What You Eat. So we're going to talk about food and cancer. So first question out of the box, are there foods that have been shown to actually cause cancer that we should avoid?
There are foods that have been linked to an increased risk of cancer, that's for sure. Many people have heard the concern about high-fat diets. Some studies suggest that. But that is not as solid as things that we know are linked to cancer, and that's primarily grilling food on a grill. We know that that causes nitrates, and nitrates are linked to an increased risk of cancer. So unfortunately, grilling food is probably not a good idea.
Ever?
Well, that's the word ever. It's like everything else. If we can do some things every now and again, and it's probably fine, but grilling every day would be a bad idea. Even grilling 2 or 3 times a week is probably not a good idea. Grilling once a month, or maybe once or twice a month, is probably not so bad.
All right. Is there any truth to the legend, the myth, however you want to characterize it, that sugar can cause cancer?
Well, there's different kinds of sugar. There's glucose, sucrose, and fructose. So glucose, which is sugar, is required for us to live. Our brain doesn't work without glucose. It requires glucose. And our body composition, our muscles can't work without glucose. So the fact that you need glucose to live, sugar to live. Table sugar is made up of glucose and fructose. Fructose is fruit-based sugar. And high fructose corn syrup, you may have heard of in the lay press. Too much of that has been linked with an increased risk of some cancers. So too much fructose may indeed be something you want to stay away from.
Conversely, are there any foods that will help prevent cancer?
Unfortunately, one food linking it to cancer has been very, very difficult, and that's because a food is made up of all sorts of chemicals. And so there may be 10 studies looking at tomatoes, and 7 say it decreases the risk of a certain cancer, and 3 say it doesn't. And that's because the devil's in those details, because of the other things that those individuals might have consumed. Probably the foods that have been most linked with the cancer reduction are the crunchy vegetables, the cruciferous vegetables like broccoli and cauliflower and kale. Those green, hard vegetables, most people do agree, do decrease cancer risk.
Since we're talking about eating, how important is maintaining a healthy weight?
It's the most important thing. How much you eat is far more important to influencing cancer than what you eat. We'd like to think that we could eat as much as we want, but what we eat is very important, but it's the absolute opposite. How much we eat is. So for example, eating too much, too many calories, leading to obesity, is the second leading cause of cancer that's preventable. The leading cause of preventable cancer remains tobacco. The second leading cause of preventing cancer is overweight. So if we decrease the amount of calories we consume, we're going to decrease our cancer risk dramatically by 30% in some studies.
Let me read this, make sure I get it right. A recent report issued by the Journal of the American College of Nutrition said that only 1 alcoholic drink per week increases the risk of mouth, pharynx, and larynx cancers by 24%. What about alcohol is bad for you?
Well, again, that's a snippet, like a snapshot out of a conversation that people take out of context. I suspect this is the same sort of thing. We do know that the combination of tobacco and alcohol increase a variety of head and neck cancer types, including laryngeal cancer that they're talking about. However, what you don't hear in that one sentence is whether these were smokers or not. It turns out that alcohol with cigarette smoking are potentiating agents. They work together synergistically. In the absence of tobacco, the influence of alcohol on head and neck cancer risk is far, far less. And there's strong data that 1 drink a day actually decreases our risk of dying overall.
Very well. What's the connection between meat proteins or high protein diets and cancer risk for middle-aged adults?
Well, it's like everything else. It's not true that what you eat is good for an individual throughout life. It may change. So cancer risk increases. The most common cancers, the risks increase until we die. That'd be prostate cancer for men and breast cancer mostly for women, lung cancer for both groups, and colorectal cancer. The risk increases until we die. However, the dietary influences on those risks do not stay static. And the one that is most been well studied and most clearly changes is the amount of protein we eat. So until about the age 65, Medicare age, having too much meat in our diet dramatically increases a person's risk of cancer. And the reason for that is that meat protein has growth factors, you know, growing muscle, growing other tissue, and growing cancer. And so until about age 65 or so, too much protein is not a good thing. And so you want to lower that volume of protein if you want to reduce your cancer risk. And it's not really needed to have a lot of protein in the diet to live just fine. However, over the age of 65, and indeed the older we get, the more frail we get. And more people, when they get into on a retirement budget, can't afford meat. They prefer to buy carbohydrates and other things. So their protein in their diet goes down. They're already getting weaker. They're getting frailer. And they compound that by taking less protein in their diet, and they end up breaking their hip. So we need an adequate amount of protein in order to maintain or stave off frailty. Beyond that, it turns out that protein may be helpful in fighting cancer in the older age group as well. So there's sort of a middle ground, both in that age group up to 65, not too much, or else you're going to potentiate cancer, and staving off the side effects of frailty over age 65 is probably useful as well.
All right. It seems like in the information age in which we live and the flood that comes at us, it seems like every day we hear something about the cancer risk or benefits, what we eat or drink. Constantly we hear something that's going to help us prevent cancer or something that's going to cause cancer. Common sense advice, what do you do when you hear this conflicting and confusing information?
Right. Well, as I mentioned before, the single most important thing is to maintain a healthy weight. Although body mass index is influenced by your muscle mass, in general it's mostly influenced by your waist and the amount of fatty tissue a person has in their body. So if you can maintain a body mass index 25 or below, you're really doing yourself an enormous favor. And certainly, if at all possible, below 30. So and there is some evidence that exercise, in addition to the amount of calories you consume, work together to decrease cancer risk. There's increasing evidence that that's actually true. So not eating too much, not too many calories, and combining that with exercise. And by the way, you don't need to be a marathon runner. And as little as 5 minutes a day of active exercise, running on a treadmill or running outside or bicycling for 10 or 15 minutes a day, or even 2 or 3 times a week, is sufficient to, in addition to minimizing the amount of consumption of food, to decrease your cancer risk. And that is more important than what particulars are of what you happen to eat.
Very well. Doctor, learn something as always. Thank you very much.
Thanks.